thank you, everybody. This panel, as the video alluded to, is really thinking through what does wayfinding look like as you forge a new frontier. And a big part of how, in our pre-conversations with each of these esteemed individuals, we had a number of mental models in terms of solving a lot of the items that came up in the video. And what we'd like to discuss today is managing the combination of opportunity against risk and the dimensions of that in multiple contexts. So the clinical context, we have a unique opportunity. We have two clinicians joining us, and we have a very deep technology leader. So I think the ability to leverage technology in the context of what are the experiences of the consumers of healthcare as we forge a new frontier. Take chances, but hopefully don't get eaten by lions. That's the essence of what we'd like to cover. So to start off, maybe we'll start around the delivery of healthcare. This is a fairly technology-centric audience, but I think maybe we can start perhaps with you, Vineeta, because you're practicing. You can give a little bit about your background, and you can talk about how you're thinking about in the number of contexts that you kind of work in, how you're thinking about the delivery of healthcare and how AI will impact it.
Sure. And thank you so much for having me here. I'm a general partner at Andreessen Horowitz. We invest in early stage health tech companies, and I also see patients on a weekly basis at Stanford in a cancer survivorship clinic. So I take care of complex primary care needs, actually, for complex care delivery patients. And several of my partners at Andreessen Horowitz actually describe the AI trend, just zooming out from healthcare for a second, as one of the major technology trends dating back to computers, the internet, mobile, and now maybe AI, right? So just for the zoom out context on where AI trends live in infrastructure land before we get to sort of applications and apps, that's an interesting perspective, that we haven't had a shift like this in terms of how our underlying data is going to live, how we're going to be able to access that data, communicate about that data, share that data, drive insights from that data. That's kind of at the level of computers, internet, mobile, and now AI. And so now we have this exciting question where most of us are not going to be inventing the infrastructure of AI. Rajeev might do some of that. But most of us are going to be working on apps and where to apply AI. And so the most common question I have with my own portfolio company CEOs, with innovators in the ecosystem, with hospital, health system, provider, payer leaders, is where should I start? Where should I start thinking about an AI application? And you heard about a whole bunch in all the panels this morning. Should I do acute kidney injury, prediction? Should I, help a physician auto-scribe their note? What should I start with? And I'll just offer kind of a framework that I use at the risk of throwing one more framework into all of your brains and notebooks, which is a really simple 2x2. A good consulting framework for all of us to take home, which is on the x-axis is it easy for humans or hard for humans? And on the y-axis, is it easy for AI or hard for AI? And that is truly how I think about almost all applications, whether they're administrative or clinical. And the quadrant you do not want to start in is easy for humans, hard for AI. And sometimes we forget that things do live there. Facetiously, that could be automating hospital laundry. That's not where you want to start, right? But less facetiously, it could be, there are a lot of things that are still hard for AI that require clinical judgment, people judgment, operations, medical transport, lots of things that just aren't AI. And where I love starting is the bottom right, actually. Easy for humans, easy for AI. That's where a lot of our administrative use cases live. That's, helping postpartum mom make an appointment efficiently with the system. Moving towards hard for humans, easy for AI. That's guiding postpartum mom about what's going to happen on day 4 after she's already delivered baby in an intelligent way. And then eventually moving into hard for humans, hard for AI. And that's maybe predicting who's at risk
Yes.
of a complication. Or sorry about that. Keep you on your toes. And so that's kind of a simple framework I use, and you can apply it to any patient journey. You can apply it to any operational workflow, and whichever quadrant you end up starting in, the thing you really don't want to do is harm. And so you have to be really, really cautious in our industry that we're not causing harm. But hopefully that's a helpful way to start thinking about the application landscape.
Yeah, that's phenomenal, Vineeta. Rajeev, as Vineeta alluded to, you're really thinking deeply, I think, about many of the hard for AI problems and where there's real value, I think, in that top quadrant. How are you guys thinking about it in terms of your maybe a little bit about you first, your platform, and then a little bit into how you guys are thinking through?
Yeah, well, thanks for having me. Congrats on Emids' 10th year now. I think it's phenomenal progress, and great to see, I think, the amazing group of people that you always pull together year in and year out. Always nice to come here and network, catch up with some colleagues. Yeah, in terms of our company, so I was at Elevance until recently and joined Lyric, which was a spin out from a company called Change Health, which was acquired by Optum. It seems like most companies end up with Optum these days, so we'll see. So since being spun out, we rebranded the company as Lyric, and what we do is essentially sit between providers and payers and simplify business transactions between providers and payers, i.e. the claims. And so, as you can imagine, that means a lot of data flows through our platform to the tune of claims data for over 185 million lives. And so natural sort of, let's say, raw material for creating a lot of AI, applications. And the way in which we're using that is really stuff that AI is good at. So to Vineeta's framework, which I love as a former consultant, easy for AI to do and relatively hard for humans to do, which is look for patterns in vast amounts of data and with reasonable accuracy predict what might happen. And so that's what we're doing, which is cleaning up the transactions so that payers and providers can focus on the things that truly require human intervention and human judgment. Whereas today, pretty much every transaction requires some level of human involvement, and that detracts from the small few transactions that do require a greater amount of collaboration between all the parties. So our goal is ultimately get the healthcare system to the point where only the exceptions require collaboration, and most routine stuff could be handled through AI.
Yeah, interesting. Dr. Schlosser, you have a very large, maybe a little bit about yourself, and I'd be very interested in maybe you building a little bit more around the patient dimension and how you think adoption of these technologies. I think we all have some sense of how it's going to help the economics of the businesses we operate inside the healthcare ecosystem, but how do you think it's going to impact those that have to consume these foundational pieces?
Sure. So Mike Schlosser, with HCA Healthcare, we're largest investor-owned healthcare system in the United States, take care of about 42 million different patients every year across 21 different states. I think that the 2x2 framework is very simple. We have a very complex, multidimensional framework we use, because why not? But I think
support that still.
when you break it down and simplify it, I think that we're highly focused on where AI can create the most value for our care teams and those who deliver care in our hospitals. And so sometimes that's put under the umbrella of administrative burden, but I really think it's far broader than that. But the reasons why are very simple, and that is that we have enormous inefficiencies in the healthcare system, a lot of which lay on top of the people who actually have to provide healthcare. We heard a lot about that this morning as well. Paper processes and documentation and all these extra steps that regulatory burden and electronic health records and a dozen other things have created for our care team members. So you have highly skilled, highly trained physicians who are spending tons of time doing things that don't involve critical thinking, not operating at the top of their license. And that's massive waste that is being consumed and paid for by the healthcare system and ultimately by us, by either the taxpayers or those paying for our benefits. And so we see that as just an ocean of opportunity. And I think it also does fall into that lower axis of things artificial intelligence is good at, because especially generative AI, large language models, healthcare delivery is all about language. It's all communication. It's all finding information, understanding it, synthesizing it, communicating it to someone else, bringing various people together to communicate it. And so those are the things that large language models are good at. And so if we can take those processes and then start breaking them down into sizable chunks that we can tackle, and start deploying AI and generative AI to start clearing those away from our caregivers, we can unearth big percentages of their time. I mean, we're talking 30%, 40% increased capacity for us to get patients into the system and get them access to care, for our nurses and physicians to be able to focus on patients, make better critical decisions. And the downstream benefits of that to the patients will be enormous. And so rather than sort of trying to jump right to, let's have the AI sort of interact directly with the patient, which I think, again, comes back to the risk part of this, which is, well, now we got to be really careful about what that AI is telling the patient. Let's just have the AI free up the doctors and nurses to be the ones to focus on patients. And that should raise all the boats. And then at the same time, we can test lots of other use cases, learn about AI and what it's capable of. And we've got a broad portfolio of use cases we're studying. But we want to go right to the heart of this. The other reason why that is that this is a population, our caregivers, who I think have been just absolutely beat up over the last 5 or 10 years. I mean, the pandemic was the last hit over the head for these folks, but it had been building way before then. And so they're an incredibly stressed group of people who show up every day because they were born with this altruistic need to help other people, and then we've just sort of beaten them down. And if you talk to care teams in hospitals or other care settings, I think you'll see that I'm right on that. And so we've got an amazingly powerful tool. Let's use it to help them get back to where we want them to be, and then we can go sky's the limit beyond that.
That's awesome. So in that context, kind of the next kind of vector of discussion is, so as we move away from humans at the center to maybe humans assisted by AI in many of the different domains and use cases you described, how did that change what we value inside our organizations, what we value in terms of maybe enterprise value as we think about operating our businesses, and what our members, patients, consumers value in terms of their experience with us? Maybe I'll start with you, because we started off on went that way, and we'll come back this way, and then you guys can jump in.
Sure, sounds good. So I would say absolutely number one on my list is data. Like we are completely rethinking data strategy across our organization, data as a product, data platforms, because an AI strategy is a data strategy. In fact, it has to be a data strategy. Otherwise, it's a gimmick, it's a toy. And so we've always been interested in data. We have probably the largest clinical data warehouse, enterprise data warehouse in healthcare that we've had for the last 12 years. But the way AI consumes data and the way we organize data for AI to take advantage of it is different. It has to be different. And things like on-the-fly de-identification of data would not have been something we really would have thought was important in the past. But being able to rapidly serve up massive data sets in a de-identified way is the center of an AI strategy. And so we're very much rethinking, and we're literally in the middle of this process right now, how we leverage cloud and cloud tools to organize our data in such a way that AI can take advantage of it. And then as you look at that strategy, it starts to trickle through the organization, and you start to sort of follow the threads. And it means that your business units start thinking different about their applications and their systems, because the function of the application may stay the same, but the value it creates may be a lot less about the end users and what they do with it, and a lot more about the data that it brings and contributes to this massive data lake and this infrastructure that you create. And that has you start thinking differently about how you would configure an application like that. And you start talking about things like driving standardization at a very high level because you want standard data to flow back into the system. So that would be, my number one is you got to really focus on the data. How does AI take advantage of data, and then pull those threads all the way through where all that data comes from, the systems, and then on down. And then I think the second thing that it really brings into focus is this concept of responsibility. And so you now have an amazingly powerful tool. How do you deploy that responsibly so that it's ethical, it's fair, it's balanced, but at the same time that we're responsibly taking advantage of what it can do for us, that we're not just sort of putting it on the shelf and being scared of it, we're embracing it and leaning into it in a responsible way, and in deploying the technology in a way that it solves some of the biggest problems in healthcare. So we've got to know what those problems are. We've got to understand what AI can do and what it can't do. And then we've got to responsibly deploy it in a way that we get the lift. The last thing I'll say, and then let my colleagues weigh in here, is that all of those innovations that you spoke about, computers and then internet and then mobile and now AI, like healthcare has sort of glanced off them, right? Like we've never really fully embraced all the way a lot of other industries have. We've got to go all in on this one, and it may be a good thing because maybe we get to leap over a few that others sort of suffered through, and we can go like right to this new version. But this is our opportunity in healthcare. We've got to seize it. We've got to lean all the way into it. And that's going to mean sort of maybe cleaning up some things that we didn't lean into entirely in the past. But this is our chance to create a healthcare system that works. And AI, I think, is the tool that can do it.
Vineeta, you really get to see the future in many ways. It's like you have a crystal ball, because all the companies that we will probably engage with 7 to 10 years from now as household names, Andreessen Horowitz is at least speaking to them. So as you look at what you value in your portfolio and what you think, put your futurist hat on, where the value will be coming in healthcare and then beyond healthcare, how are you thinking about it?
Yeah. Well, you use the word value, so I'm going to key off that. And I would say if the healthcare system writ large in the United States does not transition to value, we at Andreessen Horowitz are going to look back pretty sadly on these few years, because I think every one of those technology transitions is uniquely suited to help us actually transition to value. So, I think you're right, that we kind of jumped on mobile a little late. COVID really caused the healthcare system to adopt mobile. But mobile is the, underpinning and enabler of some form of continuous asynchronous patient engagement, which is the underpinning of a value-based care model and the underpinning of, any system that doesn't require, isolated periodic fee-for-service touch points. And so now what will AI do in that same transition that we started with web and mobile in healthcare? And I think it's helping us holistically look at value rather than fee-for-service cost. And I think there's just so many patient scenarios where this becomes really evident. And it does, I think, the best place. I'm also most excited about provider enablement as the key vector on which value-based care becomes possible. To make that possible with economics and unit economics that can scale. I know many in this room have tried, and sometimes it's hard. It sounds magical and it sounds like something everyone can do. Obviously, implement a VBC bundle, boom, boom. It's not, right? Like multiple organizations that we've all worked with struggle with how to make the unit economics work on that. Well, fine, you said you were going to contact the patient every day for 6 weeks. It turns out that's expensive. Like, it's not working out. The math's not computing.
Big surprise,
you said
right?
You were going to predict which members actually we're going to get hospitalized and only focus, spend additional resources focusing on them to make your managed care math work. Well, you couldn't figure out who they were. So in all of we've run into these hurdles again and again where it turns out, MLR reduction is a complicated game, and it's not just about, a coding, manipulation. It really is. It's hard to know what to do for whom and when. And so that's where I think AI gives our providers real superpowers. It gives them superpowers in a fee-for-service world as well. It will help them document and deal with the total overload of administrative burden, but it really helps them and supercharges them in a value-based world where they are on the hook potentially incentivized, riled up about how they can provide better proactive care, how they can better predict where their patients are going to need help in the next 6 months, where they're going to, we have a company in our portfolio called Waymark Care that recently published a white paper with United, really documenting the ability for a Medicaid, in a large Medicaid claims data set, to build AI algorithms that could predict when Medicaid members will be hospitalized. That is not something a PCP knows how to do today. That's squarely in the really, really hard for people and actually doable by AI category, where you can predict with extraordinary accuracy when a member is going to end up in an ER within the next 6 months or 12 months. And that's dramatic. We've never had that capability as providers before. So I really think that AI is going to hopefully help us leapfrog, at least in certain business lines and for certain member populations, into a true value-based care regime.
Yeah. Amen, right? Like, honestly, we really need to get there given the cost and the demographics. Rajeev, one of the things that I think Michael started with was data.
Yep.
Data as the foundational enabler, as the fuel in the tank. How are you guys thinking about what you value and what your customers value?
Well, I think at the end of the day, what our customers are looking for is impact and return on invested capital, and so that I think doesn't change with tech and how tech evolves over time. What I think to Vineeta's point, I think what AI gives us is the superpower to turbocharge the impact we can create. Because it's more scale, more quickly. It's more value delivered to multiple stakeholders faster, and ultimately to predict and prevent versus to react and respond. Vineeta is absolutely right in that the data sets absolutely give us the ability to predict what will happen with a reasonable amount of certainty. And given that, it's really the cost of the response to that needs to go down, because you can't create the interventions at scale. So that's where I think AI can help, because the lower grade interventions could happen with AI, and that's ultimately what we're looking to enable our clients to do. So that's one. From a consumer perspective, looking outside in, I think the measure of success will be when we no longer have to make trade-offs between price and choice and network and experience. And AI should be able to help optimize each and ultimately deliver a experience that is superior to that of any other sort of consumer tech experience. And that's should be sort of the key design principle for getting this right over the next few years.
Yeah, that's awesome.
I do want to make a comment about value, using the value-based care comment, because I do sometimes get a little bit frustrated that we assume that, or we talk about the clinicians in our healthcare system as if they're not interested in providing value. And some external force has to come in, be it payers or government or someone else, to create a framework of payment that's going to encourage them to drive value. Because I haven't met many of the doctors or nurses in my life who think about even a fee-for-service world around, if I provide low-value care, I'll get to provide the complication, treat the complication too. So I'm going to provide low-value care. That's not how clinicians think. Usually, we do the best we can with the time and the resources we've been given. And so I still feel like if I'm a physician in 2023, do I need more time back in my schedule to make critically good decisions for my patients, or do I need an AI giving me another signal of something else it thinks I need to do to be better for this patient who's sitting in front of me? I only need the first. I do not need the second. And so we've got to do the first. We've come to a point in our organization where I've said, no more alerts to clinicians. We're done. They actually are already oversaturated. They're not paying attention to the last 10 that you created. So no, we're not giving them the 11th one. We have to use the technology to decrease the burden on them first. Then we can start figuring out how do we get more intelligent signals to them on their phone, wherever in their workflow, wherever they are. So I'm a little passionate about that topic, as you might see.
So I am too. And just for the purposes of discussion here, I totally agree with so much of what you just said. But I'll say what's the challenge is that even though providers desperately want to provide value, When I walk into my clinic, it's a schedule of visits that were scheduled weeks ago. And it's to follow up on the lipid panel, and it's to check in on, how, something went 3 weeks ago. And it's actually often not the patients who I really need to find time to call, but they're not, like, they're preferentially, systematically not on my calendar and not on my schedule, right? Because the system didn't create any incentive for me to call Joey, who ended up in the SNF and then, got discharged and was the last person who thought about calling his PCP to make an appointment. So that's just it's not that I don't want to. I literally don't know that Joey is out there and that he got, you all are probably doing really creative things to give your physicians ADT feeds and all of that. Most health systems aren't. I don't have those. And so I wouldn't know. So to me, the value-based payment regime helps organizations enable their physicians to hopefully restructure their lives towards some more panel management than, hamster wheel on the schedule. But I agree, it may not always work out that way. That's the pipe dream anyway.
Well, I think I was going to say, from a consumer standpoint, when I see any physician, anecdotally, it just always feels rushed, and it doesn't give me anything that I don't already know. So I would rather actually deal with an AI.
We got to do better.
to get more information, query it, because large language models are just that, right? Which is that it's made knowledge conversational. Of course, there's a huge body of work that's in front of us to make it conversational with medical knowledge. But when that happens, it's a question of when, not if.
Yeah.
Then I would rather deal with that than, honestly, a hurried physician that has 10 minutes out of their day to see me.
Yeah, and I think part of what you're speaking to is where there's structural barriers, right, to the goodwill of the participants in the system. And AI is one, I think, of the tools, but not the solution. And it does require a combination of redesigning in addition to redeploying. And I think many, at least I see in our own Emids practice, there's a lot of focus on redeploying technology, solving for it at the tools level, when perhaps there's a rethink at the way we work, not how we work. And that part of the conversation, I think, is when anytime you enter a new frontier, you have to ask yourself, are the procedures, the things that I did to get here, going to be the same things that I do to go there? And that's a non-trivial conversation, and it requires many of the stakeholders that I think are interested in this to kind of get together and really co-create something new, and that'll take leadership across the industry. As we kind of wrap up here, I'd like kind of lightning style. We have a new partner in healthcare, AI, right? We don't know exactly how he, she, they are going to look, but they are here with us. So lightning style, what do you think? Put on look in your crystal ball, and how do you think in the next 10 years this new participant in healthcare will make an impact? Maybe we'll start with Rajeev.
Well, I think looking at the next 10 years, I think the only companies in healthcare that will be profitable are the ones that would have figured out how to apply AI at scale within their companies, period.
Yeah. That's a very loaded statement. I wish we had another 45 minutes to talk about that. He's a master of the hook, like guaranteed. Somebody go find him.
For next year's panel.
Yeah, next year's panel. Vineeta?
So I'll say I think equality is somewhat overrated in the context of how we think about applying AI. And I know that's a loaded comment, and I'll try to unpack it in just a minute here. And I think loneliness and the value of conversation is actually underrated. And so when I think about a patient journey, I think there's going to be a huge, huge role. The number of patients, Vivek Murthy's talked about this, but the number of patients I see, every week who are incredibly lonely, who don't have enough time with their providers, who are looking for more constant engagement from the healthcare system is extraordinary. And I think, to the point you made earlier, it's one of the unique capabilities that we have that AI could help us feel as a healthcare system very, very omnipresent for patients. I wish I could text my patients multiple times a day, and I know they want that. They do not. Most patients, especially those with multiple comorbidities who spend a lot of time with the healthcare system, do not. It would not be a burden. It would be a joy for them to receive messages from a provider that are actually accurate, intelligent, and collecting data about them. So I think that's just this hugely still underrated component of what AI can do. And it does not have to affect everybody equally out the gate. All of our biggest technology innovations, computers, the web, mobile, and now AI, actually started with kind of different populations in which they had the biggest impact. And it wasn't the same for everybody. Sometimes I think we get caught up in this conversation where AI has to do exactly the same thing for every patient, and it won't, because the data is different, the patients are different. As long as we're not doing harm, I really hope that we can, lift the boats, and not at the same rate for everyone, but lift the boats collectively to make our patients healthier and less lonely.
Yeah, equity and equality are not the same thing, right? And
exactly.
I think really focusing on how AI can provide equity in the life event so that that individual gets what they need in that moment is so key. Michael, any final thoughts?
Yeah, I want to key on something you said, which is about how we are going to have to redesign delivery. And I think it's why we're both right on the value-based care conversation, is because inherently what we actually have to do is redesign the way care is delivered, not try to add things on top of our current process. And so we're very focused on that this isn't just about adding AI to our current processes. It's about, okay, how should this actually occur? What would be the ideal state? And can we use technology to actually bring that ideal state to life now, rather than sort of just incrementally layering, one more thing, like one more alert on top of a broken process? And so not giving you a list of patients that's going to consume your all day, and then also an intelligent list of everyone you need to call that you don't have time to call, but how do we actually reorganize delivery so that you're seeing the right people at the right time, you have the right information at your fingertips to affect change for those people. And so it's going to require some serious effort to dig in, boring stuff like process engineering, going and dissecting these processes and then rebuilding them, redesigning them, if we're really going to transform healthcare delivery with AI. And so that's not the sexy part of the work, but it's the really important part of the work if we're going to truly harvest the value. And then I'll just, because I have to, I'll reiterate what I said in the video, which is do not overlook the change management, because you can, and we have shown up with just an amazing solution that is much better than the current way we do something, and get just a surprising amount of pushback. I had a nurse leader describe it to me this way. They're like, I know my unit is a giant mess. It's like a huge messy closet, but it's my mess, and I know where everything is, so don't touch it. And so we have to pay attention to the change management.
That's awesome. Well, I want to thank you all. It's been a phenomenal conversation. I really appreciate your insights. You can give the panel a hand. I know we're about to break for lunch. In the context of this conversation, we have our innovation studio. I would encourage you all to go take a look. We have some interesting kind of conversational pieces there. I hope everyone has a great lunch, and we'll reconvene after that. Thank you very much.